Uterine fibroid embolization is a non-surgical treatment for women who want to avoid a traditional surgical procedures. There are some that grows on the uterine walls and are called submucosal fibroids. Others form in between the uterine walls referred to as intramural, while those that appear hanging on the outside of the uterine walls are called pedunculated fibroids. This is because they have overgrown extensively. They are the types that can be diagnosed and have been diagnosed recently. They have no particular cause, although there are risk factors that are hereditary.
So first of all, black women are generally more prone to fibroids than white women. That's always been a known fact. But in addition, you will actually tend to see that fibroids tend to run in families. So if someone has fibroids and you ask along the family line, you're more likely to find a sibling or a mom who's also suffered from fibroids. So we do know to that degree that there is some level of genetic involvement.
There are symptoms that include vaginal bleeding that can cause anemia and lower abdominal pains that radiates to the back. At times when they have overgrown, they make someone to pass urine more frequently than normal. When the patient is pregnant, she is introduced to pain meds until she is due for delivery. Apart from surgery, there are uterine artery that supplies blood to the fibroids, which is clipped by a process known as embolization that prevents fibroids from getting nutrients and hence shrink and die. Risk factors accompanied by it include early menarche, nulliparity, obesity, late entry to menopause, positive family history to uterine fibroids. The patient also experienced pain during sexual intercourse, heavy menstrual bleeding, bladder and bowel dysfunction. Jolenta shares her painful experience.
I usually had some severe crampings. That's when we went to the doctor with my mom at Thika level 5. Basically, we were just checking what's up with the cramps, and that's when we did a pelvic scan and I was diagnosed with the fibroids. The guy kept like pulling, like I felt like he's pulling my stomach from outside, and I told him, I think whatever you're pulling is not the remains anymore. I think you're pulling the fibroids and it is not supposed to be like that.
Dr. Nelly also had this to say after she had some few patients to attend to and tells us what causes fibroids.
Fibroids are treated with consideration for many things, so care is usually very personalized to the patient. So for instance, we have somebody with heavy bleeding and they're 49 years and you know it's the fibroids that are the problem. They're almost at menopause. They're not intending to have any more children, so your treatment approach will vary.
Reporting for News Outlook, Tandao TV, I'm Sharon Wafula.